My name is April Larsen. I'm with Classic Lifeguard. We are the Aero-Medical service who's going to be coming into Los Alamos in the next month or so. I'm the outreach director, and so I travel between all of our 6 states and I teach quite a bit. And so we're going to go over about information about your heart and heart healthy and MIs and so on. So I'm a full-time flight nurse and outreach director, like I talked about. I've worked in a level 1 trauma center, which is the highest trauma center that you can get in the United States, as well as several urban and rural areas of Utah. I own a medical teaching company that I own with my husband, and I have 5 kids. Yes, very busy, and travel as much. So we're going to watch this short little video real quick. Oh, hold on 1 minute. Oh. We went a little far. Hold on 1 minute.
Okay, move objection deadline to the third line after survey. What are you doing down there? Did you finish your breakfast?
Yeah, that is my house. All the time. No, that's about, yeah.
Eat something. Here. Okay, 5 minutes to carpool. You okay, Mom? I'm fine. Sandwich orders.
What? That's about as loud as that one will go here.
Sure you're okay? I'm fine, sweetie.
I'm so late. Why are you doing this? You okay?
Yeah, I'm fine.
You sure?
Here.
Listen, see you guys later.
Where are your shoes? Put your shoes back on, please.
That's normal conversation in my house too. Where's your shoes?
We're going in 3 minutes. Oh my God, what am I doing? I forgot to cut off the crust. Voila. Shoes on, potty if you need it. Get your sister. Okay, here. Over you move. Getting a dust mask. Mom, I think you're having a heart attack. Honey, do I look like the type of person who has a heart attack? Totally fine. Don't forget to wear the high socks with the shin guards. Forget about the shin guards, Mom. Come on, Mrs. Underdog is not gonna wait. Okay. 9. I'm sorry to bother you. I think I might be having a little heart attack. Nothing really, just some nausea, tightening of the jaw, dizziness, shortness of breath, muscle pain, achiness, this terrible pressure in my chest. Oh, really? They can be here in how long? 2 minutes. Can you make it 10? I thought I had gas. Turns out I was having a heart attack. Heart disease is the #1.
All right. So that was a cute little video that they've made about heart disease. So your heart, your health. So 267,000 women die each year from heart attacks. Many women underestimate their risk for an MI, myocardial infarction, or a heart attack. And twice as many women die from heart disease and stroke than all of the cancers combined. So we all hear lots of information about cancer, right? We have breast cancer screening. We know people who've died from breast cancer, young, old, children. But the fact of the matter is that twice as many women are dying from heart disease and stroke. Under the age of 50, women's heart attacks are twice as likely as men's to be fatal. So if you're under 50 and you suffer a heart attack, you don't have a great chance of survival. I hate to tell women out there under the age of 50. So this is a little story. This is actually, she's now a nurse that I work with, and she was driving down I-15, which is the major interstate in Utah. she goes unresponsive, crashes her car into the side guardrail at approximately 65, 75 miles an hour. So EMS responds, they think it's just, a regular crash. They get to her, she's unresponsive. She was in her early 30s and she had had a full heart attack and actually crashed her car. And we're just lucky that she is still with us today and doing well. That's her son. I just saw her at a wrestling tournament a couple months ago. So the fact is that younger and younger women are having these heart attacks and cardiac issues, and we don't really see ourselves as saying, oh, you know what? That is a young woman's disease. Because usually we say, oh, you're over 75, you're 80, possibly the chance of having a cardiac issue, but I'm good. I go running, I work out, I do yoga, okay? But really the fact is that we need to start thinking of cardiac and cardiac issues as a younger person's disease process as well. All right, so who's heard that women do not experience heart attacks like men do? I think there's lots of people that know that, but signs and symptoms can be different. They're not your classic symptoms. They're not easy to identify, and more women than men die of heart attacks and strokes each year. So for a long time, we really focused on men, and on the TV shows, what did you see? Oh, you saw that guy, he's clutching his chest, it hurts so bad, he can't breathe. But we didn't see a whole lot of women who were suffering from heart attacks. And so, and there's reasons why women, their symptoms are different. And one of the first and main ones is because that men usually have blockages. And when we talk blockages, we can talk about where they have a built-up of plaque in their arteries or a blood clot, or those in large major arteries that feed the heart. When those are large major arteries feeding the heart, that's really painful, okay? That's, ceasing blood flow, so that painful. Women get them in smaller arteries, and so that makes a difference because they have smaller amount of blood that's going through those, yet just as deadly, and so we don't experience those symptoms. Another one is we can thank menopause for this one, and our body systems, and how the high density versus low density cholesterol starts to become an uneven mismatch, and you start to get an unhealthy amount of the bad cholesterol. And then there's a lot to be said about having more weight and carrying more weight around our midsection, okay? More weight around our midsection contributes to cardiac disease because of the underlying fat and how we store that versus carrying fat in our hips and our bums, okay? All right, so chest pain, all right? What we think is that discomfort. Now, that discomfort doesn't have to be on the left side of your chest. It can be anywhere on your chest. And so we have to stop thinking about, just if it's on the left side, if it's this, that's where the heart is. It can't be if it's on the right side. Sorry. Okay, it can be like an elephant sitting on your chest, okay? But that again is more like a male and how men experience heart attacks. Usually it's more of a tightening. Lots of women complain of a tightening. And I've worked lots of ERs. I've done this for a long time. I've never once done anything else but ER, ICU, critical care. And this is what we see typically with men and women. And I can say this from seeing lots of people come through my ER. All right, so what causes all that pain? You have, in your blood, you have oxygen. That oxygen feeds the heart. Those muscles and that tissue, they need the oxygen. So when you have a reduced amount of oxygen or you have no oxygen, it causes a lot of pain. That's where that pain comes from, okay? Your body is smart, right? Our maker did a great job of telling us when something is wrong with our body. If you run too hard, you've got pain in the knee. Oh, maybe that should tell me to not run anymore. If you've got pain in your chest, it's because your body's trying to tell you, I need oxygen. Give me some oxygen. And I don't have enough, okay? And then the one thing that we want to think of is that time is tissue. It's very important. It's important in strokes. It's important in cardiac muscle. When we have reduced oxygen to a heart muscle, to the brain, to any organ, we start to see cellular death after 20 minutes. That's irreversible damage, is 20 minutes. That's why it's so important to get to an ER, to call 911, to get to some facility and see, are you having a heart attack? So some other things that women get. We get mild to severe pain or a sense of pressure in other parts of your body. Could be in your abdomen, could be in your back, could be up here. Something that doesn't seem right, that just can't go away. It's not going away, all right? Stomach pain and nausea, that's another big one for females. Females get a lot of nausea and a lot of stomach pain, okay? So you come to the ER, oh man, you've had that pain in your stomach, you know, and they come in there and you're diagnosed with the MI and you think, but I didn't have those classic symptoms, because again, women suffer those different. So what are you gonna do when you come into the ER and you have this bad stomach ache, okay? Most ERs do what's called nose to navel. If you have pain from anywhere from here to here, we're gonna do a full cardiac workup. And you say, but I don't have that pain, okay? But the funny thing is, you would be so surprised the amount of times that we find cardiac issues when you have pain from here to here, okay? So we call that nose to navel. All right, sudden fatigue or weakness, all right? I could say like, I'm fatigued 23 out of 24 hours of the day. But we're talking about like sudden fatigue, like you just can't get that energy, you feel exhausted. And weakness, okay, that's another one. You're just not feeling like yourself. Dizziness or lightheadedness, lots of times they're mistaken for lots of different things, but this is another classic sign for women. And shortness of breath, okay? You just can't catch your breath, all right? You're walking around the house, you're gardening, you're trying to do those things, and it's just really hard to catch your breath. And then breaking out into a cold sweat, as you saw that actress, you know, those more than just a hot flash, okay? This is where profuse sweating, you are sweating and it just doesn't seem right. All right, so what do? You're suffering one of these symptoms, okay? The first thing, ladies, it's time to call a paramedic. I'm married to one. They're very cute. Call them, okay? They are professional, they are great, okay? Do not drive yourself to the ER. I can't tell you how many times we've had people who've driven themselves to the ERs, but they're almost through the ER doors and they're rolling out of their car because they have so much pain, okay? Or I remember this one time, it's 3 o'clock in the morning, I'm working this little ER, and I hear the horn honking for 15 minutes. And I'm thinking, oh my gosh, so rude. So people around, I was a new nurse at this time, so rude, people around 2, 3 o'clock in the morning. I go out and that person had intentionally taken a lot of medication and wanted to come to the ER, but couldn't manage to get themselves out of the car. So driving yourself, not the best option. Okay, do not call your doctor. Doctors work in an office, okay? They have a medical assistant who usually answer their phones or a phone service, and you know what they'll tell you? Call those cute paramedics. Okay? Because what you need is you need oxygen, you need nitro, you need a 12-lead EKG, all right? Don't assume it's not a heart attack, okay? Don't assume, I'm 40 years old. There's no way that this can be a heart attack. I run 5 miles a day, no way. And then be proactive, listen to your body, know your body, and listen to it. All right, so what's gonna happen? You have chest pain and you go into the ER. What kind of things are they gonna do? So the first thing is an EKG. As we see, they hook up. Who's had an EKG done before? Okay, a little uncomfortable sometimes, right? Because they got to bare your chest, they've got to put leads on, and it takes a small glimpse of what your heart is doing. It's like a 3-second glimpse of what it is. That's all it is. But it gives us a good indication of if you're getting blood flow and what the electrical activity is. The next thing is we're gonna want you to chew some aspirin, okay? Because what aspirin does is it doesn't break up clots, but it makes them slippery. So they slide by each other, okay? So we don't have a chance that you could, if you do have a blood clot, of more of those platelets sticking. Oxygen, everybody's gonna get an oxygen. That's just the standard of care. We're gonna draw some blood. And when we draw some blood, we're looking for a couple markers. And the first one's called a troponin, and that's your heart muscle. Your heart muscle, if it's having decreased oxygen, if it's under stress, it's going to secrete a thing called troponin, and that's what we measure for. And then we'll also measure, we'll do a complete blood count. We'll look at several different things to see how everything is working inside of you. And then the last is nitro, if anybody's ever had nitro. And what nitro is it dilates those blood vessels and your heart gets that oxygen in that blood, and it really reduces pain. And nitro can also give you a headache on the flip side, but yet the chest pain has improved. And the last one is a chest x-ray. We'll look at a chest x-ray. Do you have an enlarged heart? Is this chest pain that you're feeling, is it from maybe a pneumonia? Is there something else going on? All right, so they decided that you had a heart attack. Your troponin was elevated, your EKG was elevated. They've contacted a cardiologist. What kind of things can they do? So the first one is a stent. A stent is where they go in, and if you see this little device right there in the middle, they put a stent in and they blow that up, and they open up that vessel so blood can get through. Those highways are back open again and blood can get in. Also, they could do a stress test where they send you, they don't see anything on your labs that's real significant, but on Monday they want you to go to your doctor, run on a treadmill, have the leads, and see what's going on. They could admit you to the hospital and watch. They could do what's called a cabbage, and that's where you'd go to a really advanced cardiac center and they would do an operation. They may just put you on some medications and watch, and they may say, now, we need to change your lifestyle. No more shakes every night with eggs in it. Okay, that's my father-in-law likes. We're all eggs in his milkshake. Okay, every night. They may say something like that. So the sad truth when it comes to MIs in females, that women are getting the short end of the deal with cardiac post-care. Women are less likely to get the medication needed to improve survival after a heart attack. Women are twice as likely to die 2 weeks after a heart attack than men are, and only 22% of women are involved in cardiac care studies. So we really are lacking in what is good for females when it comes to cardiac care, because for such a long time it was always men that we thought suffered these. We put them in studies, So these things, we need to move and support more research for women in cardiac care. So the light at the end of the tunnel, though, with cardiac care is that women are more likely to, if they improve their lifestyle, they'll improve their cardiac care. Education programs targeted for women, like that Go Red video. Who's heard of the Go Red program? That they really focus on women. It was funny, when I looked at that video, I looked at a little dialogue, and one man put, it would be nice if they targeted men on some of these things. Well, we do. You've been targeted forever. We're going to take the time and target on women, okay? And increased funding towards research on cardiac care is also super important. And if you have the ability to be in a study and it seems like it's something that you want to do, that would be great, because we need more women in these kinds of studies. All right, any questions when it comes to cardiac care? No?
Well, I do.
Okay.
Because I heard that a friend had just a fall. I mean, she just kind of slumped down in her kitchen, and there she was on the floor, and she didn't know what had happened.
Uh-huh.
And I think they said later that was probably a heart attack then, but she got up, she felt fine, and, she went on and didn't know there was anything wrong.
You can have little heart attacks and not know. Your EKG, when we do the test on you and look at that, sometimes it tells us you've had some kind of cardiac event in the past. And so we'd ask somebody, have you had something like this prior? And they said, oh no, but a couple weeks ago, I felt really bad, just sick and bad and out of energy, and I just didn't feel right. But a couple days, I think it was just the flu, when actually it was something more like a cardiac event.
So how do you get more of a clue that could be what happened? Or is it important every time you feel a little bit of something like that to go see the doctor? I mean,
well,
none of us want to do
no, and I agree with that. But it is important that if something doesn't seem right in your body, that you go and seek care, because we don't have these typical symptoms as far as that goes. If we ran out and saw the doctor or made an appointment, they'd stop probably booking us for appointments, right?
Right.
So I think the key is how do you feel if you feel bad, don't waste time. You know, I don't know how many people that they apologize when they come in. I'm so sorry for being here. It's probably stupid. Don't apologize. That's what we're here for. That's what we love to do. We're actually junkies at it. We love it so much. Like, that's what we thrive on. So anyhow, so I think those are some of the important aspects when talking about cardiac care for women.
Recognizing the signs of a heart attack in women. So
Yeah.
what again are the signs?
So the
of a
signs,
heart attack?
okay, so the signs in heart attack women. So profusely sweating, okay? Having a pain somewhere in your chest, doesn't have to be on the left side, the right side. Feeling sudden fatigue or weakness, okay? Another one is you could have pain in the arm or up the jaw, but again, up the jaw and pain, that's pretty typical men. You'll get men with pain in their jaw, down their arm. Sometimes just a tingling sensation, maybe in your back, down one arm, but you wouldn't really say that it's pain. So very just vague symptoms. And I know that's hard for women. I know. Another thing is how many
Do you
women
have trouble catching your breath or
you can
feeling
have,
like you can't breathe?
yeah, trouble catching your breath, having a hard time breathing. That's definitely another one, just feeling short of breath. You know, and another one on women, which we kind of saw in that video, is like, how many times are you like, okay, I have 10 things to do. I have approximately this many time before I have to start this and this and this and this, and you got to get all this stuff accomplished. So women put this stuff off for a long time because they really have more important stuff to do, okay? So, and the last thing is, do you know what the number one, the biggest stress that contributes to cardiac disease in women is? Does anybody know? Marital stress. Yeah, exactly. Those men give us a lot of stress, okay? So, and one of the things that they really recommend is that, you know, decreasing their stress. Like, I should never be one to talk about decreasing their stress. I only thrive on stress at all times, so like, I should never say that. But it really is reducing your stress, reducing and how you deal with stress, because it really is shortening the lives of women and causing cardiac issues later in life. Yeah, so.
And are there other health issues that can make a big difference? Like, well, I guess it said things like, you know, don't be so overweight, or, you know, are there different vitamins? Or
No, not
sleep
vitamins.
practices,
The same
or
thing, and this is the
activities?
same thing I think about, like the Ebola stuff and taking care of yourself, okay? So you may come in contact, you may in your life come in contact, you could have been on the plane with that nurse who had Ebola and then flew, right, to Ohio. You could have, but if you keep your body healthy, if you get sleep, if you exercise 30 minutes a day, those kinds of things are going to keep you, are going to protect you from cardiac issues, are going to protect you from getting sick, getting the flu, getting viruses. It's when your body gets run down that you have no defense mechanisms left is really where you have the problem and you start to have issues. So, and I do believe that, and eating healthy, and I'm a big cut out sugar person. It's hard because I'm a sugar junkie, but I know it's hard. It's like it's like crack. I call sugar my crack, so I know. So anyhow, all right. Thank you very much. I appreciate it.